to my class, that is Prep with Daljeet, and here in this video I'm going to talk about the day one, the OET introduction plus test requirement plus English foundation. So the objective of today class is to help learners clearly understand the exam structure, means OET exam structure, scoring, expectations, and correct basic English patterns commonly used seen in the Indian nursing professionals. So let me tell you, my class is most of the time bilingual. That I teach in English as well as in Hindi, and sometime I use Punjabi for because my class is completely for the Indian origin students. So let's understand what is part one, that is OET nursing overview. So this is basically for the nurses. So what is OET? OET stands for Occupational English Test. That is a healthcare specific English exam used for nurses registration in country. Like means if the nurses want to go to UK, Australia, New Zealand, Ireland, Singapore, UAE, Canada for some pathway programs, they must use this program OET. Why OET is ideal for nurses? Yes, there are a number of reasons. First of all, it's a clinical scenario. Test communication, not academic English. Writing and speaking are profession specific. So most of the nurses find it easier than OET, than IELTS or PT. Reason being, it's a profession specific writing and speaking. They are already familiar with such kind of things, and yes, clinical scenario is there. They are also familiar with that. So let's talk about the format. That's a glimpse of the format. I will tell you in detail what are the format, what format contain. So listening contain some like 40 minutes, that is of 40 minutes, and you need to understand patient consultation and workplace audio. Reading is of 60 minutes, and that is a lengthiest part of the OET, where students need to read the medical guidelines, policy, and patient's information. Writing is of 45 minutes, where writing a nursing letter based on the case note. Whatever the case notes are there, nurses has to write the letter on behalf of that. Speaking, that is a 20-minute role play between nurse and patient. All the time you will be given a role play card where you need to talk to your parents and patient. Sometimes you need to make the patient understand the thing, explain the thing, or sometimes you have to reassure the patient what it is. So in the upcoming lectures, I will show you the notes. Understanding OET score. So what are the OET scores? OET score range from 0 to 500. Maximum is 500 and minimum is 0. And most of the OET aspirant need grade B, that is 350. They need at least 350 out of 500 in each modules: reading, writing, listening, and speaking. If you get 420 in reading, this is grade A. That's a welcome. That's a congratulations. You have cracked the exam. If you get 340 in speaking, this is grade C plus. That's not B. That's a C plus, not acceptable for the registration. So you need to target at least 350. It could be 350 more than that. So how it's different from IELTS or PT? IELTS writing discuss advantages and disadvantages of online education, but OET writing task mention you to write a referral letter for means ABC person. Like it gives you the proper notes that how you can write the letters. Conclusion: OET is easier for nurses because it is based on real hospital situation, not academic essays. So Indian English versus global healthcare English. As I told earlier, this class is for the Indian students. So most Indian origin nurses is knowingly use direct, literally, or overly formal phrases that are not accepted in OET. Please don't mind if you belong to this profession and you do not use such kind of sentences. Means this is not for all the nurses, but maximum most of the nurses, because they are this profession specific. For example, do one thing. Instead of this, you must say that, could you please do one thing, take this tablet after food. Instead of this, you must say that, please take the tablet after your meal. So Your language must be polite, kind. Take action, don't take action. Correct us, please don't worry, I'm here to help you. In this way, means you should need that kind of tone where the listener, means of course that your patient never feel any kind of anxiety or any kind of depression. Don't take it tension, you will be fine. This is informal word, informal vocabulary. Instead of this, you must use, I understand your concern. I will support you throughout the process. So I will make you understand. Instead of this, you must say that, let me explain this for you. So these are quite small examples. Here, I will show you some of the sentences and you can practice, means what you need to do instead of that. See, I will make you understand how to take insulin instead of, let me explain how you should take insulin. Remove your clothes. That sounds too direct and inappropriate internationally. Instead of this, could you please change into the gown? Change into the gown means gown में बदलोगे इसको. Instead of saying that अपने कपड़े उतारो. Do the needfuls. This phrase is culturally Indian and not used globally. Please complete the required step. We will not say that do the needful. Instead, we will say please complete the required steps. So here is a task for you. There are some five questions are there or five sentences are there. If you want to practice, just pause the video for a minute and write down the correct answer, means the correct sentences, what you can write instead of do one thing, sit here only, don't take tension, means whatever the global healthcare English says, so you need to write accordingly. You can pause the video for a minute. Let's see the answer. So here is the answer. The tone is polite. Please, let me explain. Could you please? So that's it. So how many modules are there in OET? Means of course four. The answer has been already given. As I earlier told you, this is my PDF that I use most of the time with my students to show in the class. So that's the end of the day one. What you have learned means here, I hope you would have understanding the OET, that is occupational English test, and how it is structured. Contain four modules: reading, writing, listening, speaking. Scoring system, that is 350 you require for the grade B, and if you're getting 340, this means you're getting grade C plus. That is not nowhere worthy. Why OET is easier than IELTS? Because it's a profession specific. Of course, you belong to nursing profession, then only you come to the OET. Major Indian English errors to avoid. We have mentioned some of the errors, please, instead of do one thing, please please take to the gown, like such kind of thing. How to switch to the global clinical English. So this is all about the day 2 1, where I think so that we have completed our objective and target. So that's why I would say that we will continue with the day 2 any other time. Thank you. Thanks for watching the video.